From the baby who has a fever, a child who needs immunizations for school, or a woman who needs a mammogram. Our healthcare needs grow as we grow. For those who have little money or inadequate insurance, access to these basic health services is a luxury. And the inability to obtain these services can negatively affect the quality of life for all of us. This program focuses on CAPN, Community Advanced Practice Nurses, an organization that makes an impact on individuals and society each day by caring for those who need it most, the homeless, poor, and medically underserved.
It's horrifying, really, that people have no health insurance in this country and that we have such discrepancy in the levels of care provided to people.
I've really learned since working at CAPN that a lot of the people who use the services have been employed for 20 or 30 years. They just happened to lose their job. They were living paycheck to paycheck and now they don't have anything.
Shortly after Hurricane Katrina, Community Advanced Practice Nurses was on the front line for those families that came from Louisiana to Atlanta. It didn't surprise me that Community Advanced Practice Nurses was right there to make sure those women and children that came into our city got the health care that they needed. They were suffering from post-traumatic stress disorder. They had gone through so much. They didn't have their meds. They didn't have their identification. They just couldn't go to any local hospital and just get services, but CAPN was right there and also worked with other nonprofits to help secure housing. So it was just really impressive. They're just always right there when they're needed.
I think the homeless are often not viewed. People don't see them. They're just like you and me. They're just short a paycheck and had a foreclosure.
In 1998, 7 nurses responded to a need to care for the least of these. They founded Community Advanced Practice Nurses to provide basic health care to the homeless, medically underserved, and uninsured without regard to race, age, sex, sexual orientation, religion, political affiliation, or national origin. Without a thought of just how to organize, these nurses moved forward because they knew that not acting promptly would negatively impact lives.
Before I came here, I was involved with working with the poor. When I came here, there was only about 2 shelters, the big Salvation Army and St. Vincent de Paul was one, but for shelters, it was either the Salvation Army was the big one. And I could see at the time there were probably no shelters except in Fulton County, and the need for homeless just grew. We used to say maybe 3,300 people were homeless, but now that's a different story. When we were doing the shelters, at the time we started the shelters, most people thought a bed and a meal a night was going to change somebody's life. And I worked with Connie. I don't know how Connie got up to our 3rd floor of a building over at on Moreland Avenue, the Moreland Avenue shelter, where we had at least 100 people a night, women and children. And Connie came and I said, Connie, we have to do something with these people. I'm not a nurse. There's a lot of things that are coming. And we were just sending people down to Grady, and Grady had enough to do without getting all of the homeless going down there. So anyhow, I talked her into try to find out where we could work together. And the next thing I knew, we had a room up there, and the room was not very big, but they were willing to work with it, and I was willing to help what I could do.
And in 1998, the Georgia Nurses Foundation, because of a lot of different because of changes within their organization, changed their mission from one of service and decided they weren't going to do the clinics anymore. They weren't going to offer direct care. And so 6 of us, I think it was 6 of the professional staff, established the CAPN clinic. We grew out of that clinic. When clients would come to us and they kept saying, what are we going to do? Who are we going to go to? No one else will see us. And so they came to us and pleaded with us not to close.
So there were 125 clients living basically down the hall from us in an emergency shelter situation.
We talked to the Christian Council of Metropolitan Atlanta, who was the host agency for the shelter. We talked to the Atlanta Women's Foundation and asked the Atlanta Women's Foundation, Stephanie Davis was executive director at that time, and we said, would you mind being our fiscal umbrella? I had no idea she would say yes. And 3 minutes on the phone and she said yes, and that she would be the fiscal agent until we could establish our own 501.
So our thought was, well, you know, we can all get jobs doing something else as advanced practice nurses, but what about the clients that are living down the hall from us that come down to our clinic on a daily basis, depend on us for their health care, mental health care, children's immunizations, social service referrals, all of that sort of thing. So we really couldn't turn our backs on the clients, and also other client referrals that we were getting, of course, from the community, from other agencies. And with that, there were 7 of us that decided to incorporate as a nonprofit.
It definitely wasn't easy. We had to learn about writing bylaws and how to incorporate and learning how to do payroll and all of the basic things that an organization has to do to stay functioning. But we all banded together, divvied up the responsibilities, and made it happen pretty quickly. We were up and running within about 6 months, if I'm not mistaken.
Well, we had our little suite within the Moreland Avenue shelter, and we approached Janice Corey, who was the shelter director at that time, and said, do you think we could continue? And she was just like, yes.
One thing that we found when we first opened was that clients were coming to us who had had doors closed on them before. And so one of our philosophies is we have always wanted to have our doors open to whomever needs us. And that has really made a difference.
These highly trained and educated nurse practitioners could work anywhere. Instead, they gave up high salaries and status to create an organization to serve those most in need. This has been a benefit not only to those they serve, but has also provided a fertile training ground for young nurses seeking clinical training and a place for more experienced nurses to give back.
And they could have easily just gone elsewhere. I mean, these are not people that are just coming off the street and are filing. I mean, these are clinical nurse specialists. They could have been hired out elsewhere, and especially with their experience, I think demanded a much higher salary than a nonprofit pays, but they stuck in and did this because they realized the need.
Everyone in the clinic, all the clinic staff are master's prepared or working on their master's. So every person that they meet is an educated health professional. Every minute that you have with a person is an opportunity to impact their life. So the teaching begins from the very beginning when they walk in the door.
We work with local university nursing programs to train their nurses, or they have a rotation in the clinic. And I've seen what it can do. I've seen nursing students who are going for their RN who decide because of the clinic that one, they want to continue their education and become a nurse practitioner. I've seen nurses who want to stay working with the population that we serve. It's really touched so many people's lives.
I have a long history here. I actually started here as a public health student when I was at Emory, like 10 years ago. And I started off as work study, loved it, loved the experience. It was almost exactly kind of what I was looking for in terms of the continuity of care, the follow-up, the kind of family environment that it has here. And I ended up staying on for 5 years and went back for nursing because I went back to become a nurse practitioner and decided to come here for clinicals. So I've done clinicals at different environments, and this has been the most comprehensive because they see everyone from pretty much birth to death, and you get a lot of complex problems that you wouldn't see in other areas. So it helps me, kind of connect the dots between theory and practice.
I first became acquainted with CAPN in, July of 2000 when I came to Atlanta to be a medical resident at Morehouse School of Medicine. And part of our residency was working in the clinic at CAPN.
Well, I placed students there for a few years, and then Lindy suggested that maybe I wanted to volunteer a half day a couple times a month, and I said, sure, I'll try it. And I was just so enamored by it and so pleased to be a part of this operation that I just wanted to continue it. So I've been doing it now regularly for 2 or 3 years and plan to continue even in retirement.
CAPN is a very flexible, organic clinic, different than the clinics I had worked in before. It's constantly changing to serve the needs of its clients. So you may walk in the front door and see a normal clinic, but what's really happening there is different than what you would see in a typical clinic. So they're providing routine medical care to folks, but they're also offering life skills and care and nurturing in a way that you probably wouldn't get in other clinics. The real goal is to provide them immediate care and then find them access to reliable, ongoing health care in a setting where they can get the full range of services that may be needed. So linking them either to peach care if it's a child, to Medicare, Medicaid if they're eligible for that, or trying to find them other medical insurance opportunities or other healthcare options is the long-term goal for patients.
I think that many of them would not get care. That was our thought in '98, and that is still my thought, because so many of them come in and haven't had any care. So many women come in and they've had no women's exam, no PAP, no mammogram. They're 40 years old, and they've had nothing since they were 20. And I think there's such a misconception that poor people can get Medicaid and poor people can get health care, and that is not reality. We do have federally qualified health care centers in our community. They're the community health care centers, and they do wonderful jobs. But to enter into a facility like that, you have to have paperwork and documentation. You have to have proof of your residency. You have to have a picture ID. A lot of times it's a Georgia ID. And many of them now are requiring a basic flat fee of like $60. And $60 or $30 or $40 to many of my patients could be $500. If you don't have money for bus fare, you certainly don't have that type of money to lay out.
So there's not just a single clinic where they provide services, but they go into other service providers around Metro Atlanta and provide services where the clients are.
CAPN does more than diagnose illness, prescribe medicine, or band-aid an injury. They also administer love and hope.
The folks who work there, they really have a passion for caring for the clients that come through their door. They understand their clients and the situations that their clients may be in or have experienced. And they really have a passion for providing medical care to them in a way that they can accept it and receive it.
Well, see, I think sometimes we do not realize what we give a person by a smile even.
The smallest thing makes such a huge difference in their life and in the way they live their life and the choices that they make that affect their health, that affect their whole economic status. And it doesn't take very much to give that, but it does take your willingness to put yourself out there and do it.
I would say every single person who works at CAPN has that approach of really valuing the patients. And so that is extraordinary because they expect to come in and get kicked around, which is what they experience in a lot of settings. And I'm sorry to say, I've had people in the last year twice start crying, just saying, thank you for being so nice. Just crying because we were being nice to them. It's awful.
I think people reach out to CAPN because, number one, we're a friendly bunch of nurses. As I said, we're very grassroots in our approach. We're very approachable. You know, we're not in this big hospital setting. We're not in this big outpatient, huge clinic.
CAPN goes beyond just the ordinary services one would expect. They also provide a mental health clinic because they understand that being unemployed, homeless, can take its toll on the individual's emotional and mental balance.
Well, this is a great coffee talk. 8 of you is wonderful, and I'm glad you all stayed and could make it on Friday. Yay!
Well, I think the help prevention is a big part. I think we can help mothers and fathers with parenting issues. I mean, there's just a lot that we do other than just take care of the sore throat or the earache or whatever. And we try to get them into counseling if they need it. We know that a lot of them have mental health issues. And so the fact that this counseling is available is just phenomenal.
Our mental health program is crucial to CAPN. It's very significant, important, paramount that's included in healthcare. Our clinic and satellites are very holistic, so meaning that we're very comprehensive in our care. There's a lot of intra-agency referral between our physical health care sites and nurses and our mental health sites and nurses, so that we're constantly referring back and forth to each other about this person is complaining of depression, this person has abuse issues they've never dealt with, and they're crying all over the exam table as I'm doing their pap smear. So there's a lot of information exchange, and we're just, you know, very tandem in terms of what we do. You know, you can't adequately treat someone for their physical health problems and feel that you've done a good job if you know that they're upset about their emotional problems, well-being, psyche, whatever. You've only done half the job.
CAPN does not do the work alone. They collaborate with organizations within the community to make their efforts reach far and wide.
Well, we have a very close relationship with CAPN because CAPN is located right in our building. Their center and their primary place of providing health care is located right in the Genesis building. And it's a wonderful resource for us to have on site because that means that our parents and our babies and our children can get primary health care right here in one facility.
Covenant House Georgia is a program that's part of a international nonprofit. Georgia is our youngest site. We serve homeless and at-risk teens as well as runaways, ages 17 to 21. We operate a crisis shelter as well as 2 transitional housing programs, supporting those youth in their educational goals, housing goals, and employment goals. With CAPN, Covenant House has a great resource in providing our youth with medical needs. Our youth come to CAPN for their physicals, for mental health evaluations, and last year alone, 80% of our youth were served in that manner. So that means almost 400 youth came to CAPN to get physicals and other medical needs met.
The Atlanta Children's Shelter is a day program, and we help stabilize homeless families in Atlanta that have young children under the age of 5. And for us, long-term stability looks like permanent housing and stable employment. And so our mission at the end is to end the cycle of homelessness for children in Atlanta. So CAPN comes to ACS once a week, every Tuesday, and they have clinic hours for us. And they've been doing this, and they basically do everything but set a bone. They will provide some medication, they'll treat, they'll refer if there's a medical issue that is beyond their skills, they'll refer out to other partners. And I've only been here for 2 years, and I can tell you that in the short time I was here, I realized how important and significant partners like CAPN are to us. And I really challenged our organization and myself to say, okay, how can we do better by them? Because for 10 years, they've been providing us with so much free health care. So I thought it was time that we show them how important they are to us. And so when we renovated the facility this year, we actually built for CAPN a dedicated exam room.
Jerusalem House provides supportive housing for people that are living with HIV and AIDS, who are homeless, at risk of homelessness, low income, and in some cases no income individuals. CAPN is one of our collaborative partners. So we have many agencies that we partner with that provide services that complement our the housing services that we provide. If there is a resident or an individual or a child who is unable to access health care services with Medicaid or Medicare, then we would refer them to CAPN.
Dr. David Bordeaux has been practicing dentistry in Atlanta for over 30 years, and for many of these years, he has opened his doors to provide free dental care to the homeless population that CAPN serves.
Dr. Bordeaux started dentistry back in Atlanta over 20 years ago, and very shortly after he bought the practice that he's in right now, he decided he wanted to give back to the community. And I believe at that time, the shelter was St. Luke's. And he, I don't know if he contacted them, I don't really have the details on that, but I know that they got together and they started just seeing emergencies. And when St. Luke's would have an emergency, they would call Dr. Bordeaux. Dr. Bordeaux would have the patient come in and he would try to meet the need of the emergency, whatever it was. And then it got to the point to where it was becoming a lot, and so he decided that he would dedicate one day a month toward trying to help the general needs of the people in our community. And so he's been doing that for over 20 years. It's through several different agencies, but with the CAPN for a long time.
CAPN could not do this work without their funders. They are proud of the partners who continue to invest in the work they do to serve the community.
Well, the Atlanta Women's Foundation mission is to be a catalyst for change in the lives of women and girls. It's our goal to eliminate the cycle of poverty for women and girls in our 5-county service area, which is Cobb, Clayton, DeKalb, Fulton, and Gwinnett County. We started in 1986, and we started with a $10,000 donation. To date, we've given out over $12 million to women and girl serving organizations in our metro Atlanta area. We have supported community events practice nurses since their inception. They do amazing work. They apply just like any other applicant every year. It's a competitive grant cycle. Our donors, along with me and my colleague Jacqueline Innocent, we bring donors out to CAPN to visit, ask questions about their requests for funding, and they're always blown away by the work that they do. Well, to date, we've given out approximately $250,000 to the work.
The foundation began funding CAPN several years ago with a small grant, and over the years the foundation's support has grown as the demand for CAPN services have grown. Currently, we provide funding to help expand their capacity to serve women and children at their various outreach locations, as well as their main shelter here at Genesis Shelter. Well, from year to year, when we visit and see the kind of care they're providing to women and their families who are coming from really often desperate situations, it's just heartening to know that these women have a place to take their children to receive appropriate, compassionate, complete primary care, in addition to having a place to get medical services and mental health services for themselves.
As the country continues to move forward with the Affordable Care Act, CAPN has proven the need for and the effectiveness of health care access for all.
Long before there was serious discussion about the Affordable Care Act, CAPN was providing access to health care for folks, as we've said, free of charge. So really all it required for those individuals to get access to health care was to be aware of CAPN and be able to get there. And when they showed up, they had access to health care.
As more and more people find themselves unemployed, many will also find themselves uninsured with very few places to turn. Supporting organizations like CAPN gives an individual an option for health care.
We have to keep them in mind, keep them, we all need it. We need to be able to reach out to somebody else. And that's the part that these nurses do. They reach out and on a very, I would say, gut level, not just up in the air. And to me, that makes a lot of difference.
And so if they're not doing it, then who? I think one of the things we try to do is we try to get families, homeless families, to become self-sufficient so that they don't have to rely on government subsidies and other things. So I think you support them. One, you want a healthy community. Two, you want a thriving community that's self-sufficient. And three, they are bringing a level of skills and expertise that these families might not otherwise get.
So I thought, well, I'm going to take 3 years and work in homeless services. And that was 1994. And I can remember walking in the first day at the Moreland Avenue shelter and walking into the lower level, and you had to walk up 3 flights of stairs, and it was dark and it was dim, and I walked up and there's these huge rooms, 150 women and children in 2 large rooms with bunk beds, with lights just hanging from the ceiling, and children sitting up on the bed doing their homework, just going on with life. And I thought I understood, and I knew nothing.
Well, my hope is that the community will become aware that CAPN exists. Frankly, we're really below the radar. We're the ones that sweep and mop and carry out the garbage, and so we don't have a lot of time to self-promote. And there are lots of other organizations that you hear about a lot. You don't ever hear about CAPN because we're so hunkered down, intent on doing the health care.
Every time I come to visit one of their clinics, I am really humbled by the work they're doing, and I have so much admiration for their stewardship of the resources that they have, both in terms of the volunteers and the staff, as well as the contributed funding and supplies they have. They really are wonderful stewards of what they've been given and use it in the most efficient manner to serve the most people they can.
It's amazing at what Connie does to find funds and to keep the clinic running, often at the expense of her salary. So she does an amazing amount of work with a little bit of money.
Their staff is dedicated. I truly believe that if they didn't get paid, they'd still do the work. So the commitment is what really, for me, makes them stand apart.
But we have to be able to support the nurses enough to give them the courage and give the people the courage to keep working. The nurses, the way they take care of people and where they are, they're right there. You can't help but see them. And I think that people need to, I hate to say it, but the nurses need more than ever the support of the community.